Hi, my name is Michael, and my research is on investigating misinformation spread on hydroxychloroquine Twitter discourse using natural language processing, or NLP. As some background, on July 27th, 2020, US President Trump at the time retweeted a video falsely claiming that using hydroxychloroquine was a cure for COVID-19, despite well-documented concerns saying otherwise. Trump's retweet is related to the broader COVID-19 infodemic, which involves deliberate attempts to disseminate wrong information that undermines public health response. And this undermining of public health response is only exacerbated when there's claims that evoke scientific authorities to make misinformation claims. So the aim for this study is to look at misinformation spread, but also kind of seeing how scientific authority or studies are used to support false claims. So the methods, we collected tweets from the Twitter API using the key terms hydroxychloroquine or chloroquine as to filter for the data set. And we collected from July 27th to the 31st, so around the time frame that Trump sent his tweet. In order to analyze a large volume of tweets, since we had over 2 million, we used an unsupervised machine learning approach called bit-term topic modeling. And this kind of grouped the tweets together into highly correlated topic clusters based on their textual similarity. And we use bit-term topic modeling as opposed to more traditional NLP approaches such as LDA, because this type of method is more in line for short word documents such as tweets. Then we took these topic clusters and we coded them based on their top 10 most retweeted tweets per topic. And then we coded for basically general sentiment towards hydroxy usage, so positive or negative, and then also the 3 misinformation themes. So the first one was medical endorsements. So whether someone's saying something like, as a doctor, I support the usage of hydroxychloroquine. Supportive scientific evidence. So, this study claims that hydroxy is effective at, treating hydroxy or COVID. And then opposing scientific evidence. So, studies that basically discourage the use of hydroxy to treat COVID. For findings, over 500,000 users, the majority of them were engaged in topics that express predominantly positive sentiment towards hydroxy usage, so 88.3%, while the minority of users, so 5.5%, were in topics that expressed negative sentiment. And also users who were in the strongly positive sentiment also tweeted higher amount on average compared to those who were in the negative sentiment topics. And then of the over 2 million tweets, 18% of them were within topics featuring medical endorsements for hydroxy, 1.34% featured scientific evidence supporting hydroxy usage, while less than 1% featured opposing scientific evidence. And if you look at the timeline analysis below, you could also see how not only does it kind of reiterate how the misinformation topics have higher volume compared to the scientific opposition topic, but there's also multiple peaks within these misinformation topics, indicating that these topics are going on for a longer duration compared to the scientific opposition topic, which has about 2 small peaks in the beginning, and then kind of tapers off after the July 29th. So conclusions is that these results demonstrate the need for higher online engagement from public health officials, disseminating accurate and up-to-date scientific evidence, and also consistent messaging related to health related discourse to combat against the spread of misinformation.